In this video, you're going to learn all about yoga and osteoporosis. In more detail, here's what we're going to cover. First, we'll address, is yoga good for osteoporosis? And if it is, by how much can you expect to improve your T-scores? Then, we'll discuss Dr. Lauren Fishman's 12 yoga poses for osteoporosis. Dr. Lauren Fishman is a famous researcher who teaches 12 yoga poses to reverse osteoporosis. Does it really work? That's what we'll explore in that section. Then we'll discuss things like yin yoga, ashtanga yoga, chair yoga, and others. And finally, just as important as it is to know what to do, it's important to know what not to do. So you'll learn contraindications if you have osteoporosis. Which poses should you avoid? Before we jump in, who am I? My name is Igor. I'm the author of the Amazon best-selling book, Osteoporosis Reversal Secrets. As well, I've been a personal trainer since 2006 with a specialty in osteoporosis, and I've been training other personal trainers in my methodology by speaking at some of the world's largest personal training conferences since 2013. I've also delivered over 400 wellness presentations to some of Canada's biggest corporations, including IBM, Bosch, American Express, University of Toronto, Investors Group, and others. If you want to learn when I publish more videos about exercise, nutrition, and supplements for osteoporosis and osteopenia, click like and subscribe to my YouTube channel. So first, let's ask the question, is yoga good for osteoporosis? Let's look at what the research has to say. But before we do, we have to differentiate between different types of research. Here is the hierarchy of scientific evidence. At the very bottom layer is just expert opinion. This is just one person's opinion without any research or evidence to back it up. Slightly better than that is case studies and case reports. This is individual people reporting what happened to them. There's no control group, there's no placebo, they're not controlling for any other variables. They're just saying, this is what I did, and these were the results. The next level is observational studies with comparison groups. You're just observing, you're not manipulating any variables. The next level is non-randomized controlled trials. In other words, there are two or more groups of people divided into different groups, and the people, both the participants and the researchers, know which group they're in. Are they getting the placebo or are they getting something else? The next level up is randomized controlled trials. That is, the people are randomized into a placebo group or in a treatment group, and neither group nor the researchers know in which group they are in. This allows you to make more valid conclusions about the study. And lastly, there are systematic reviews and meta-analyses. These are studies of studies. They accumulate multiple randomized controlled trials to minimize the risk of a fluke. Any single study can be designed to find whatever you want. But if a cluster of studies says the same thing, that's really, really powerful. However, if a cluster of studies says one thing, and yet one other study says something else, is that a fluke? Is that bad methodology, etc.? Systematic reviews help us avoid the pitfalls of individual randomized controlled trials. And that is why I like to look at systematic reviews when they're available. Fortunately, there is one available in this case. Here's a systematic review titled, Effect of Yoga on Health-Related Outcomes in People at Risk of Fractures. Here were the results. What they found was that there was no benefit of yoga on osteoporosis, and there was indeed potential harm. There were fractures for people and practitioners pushing the end ranges of spinal flexion or spinal extension. An example would be a forward fold, the plow pose, or extension or hyperextension like upward dog. These are all examples of risks with no benefits. Now, that's not to say there aren't benefits for other things, maybe for your mental health, maybe for your flexibility, but if you're directly doing yoga specifically for the intended goal of improvements in bone strength, it probably won't do very much for you, and your bones will continue to deteriorate. Here's one individual study titled, Effects of Yogasanas on Osteoporosis in Postmenopausal Women. Here were the results. This one study did show a T-score improvement from minus 2.69 to minus 2.55 over a 6-month period. So yes, there was a slight improvement, but not really much to make a difference to fracture risk. And that's what really matters, fracture risk, not just bone density or T-scores. So this improvement is a very disappointing improvement over that period of time, considering there are other things that we'll talk about later in this video that could be way more powerful and way more effective as far as fracture risk and T-scores are concerned. Now, people will often point out, but what about the study where Dr. Lauren Fishman, who is a researcher who came up with 12 yoga poses for osteoporosis. Well, here was his study. It's titled 12-Minute Daily Yoga Regimen Reverses Osteoporotic Bone Loss. The results in this study were that yoga did indeed improve bone density and that it did so safely. But here's an interesting little problem. This study was sponsored by Dr. Fishman himself. That doesn't completely invalidate the results of the study. However, we should know that if there's one study that shows positive results and a cluster of studies that shows no results, which one are we going to go with? Probably the one that the group of studies that are unbiased. Now, what about other forms of yoga? What about things like yin yoga, ashtanga yoga, chair yoga? Well, there's no research on any of those directly. In the meta-analysis that we talked about earlier, it's taking yoga as a group and likely probably only hatha yoga. So there's no research on any of these. But if I was to venture my opinion, probably ineffective for a few different factors. And what shouldn't we do? What should we avoid if we do have osteoporosis? Well, you should be careful with any poses that involve extreme flexion or hyperextension, like the ones mentioned earlier. You can go into flexion, just not extreme flexion. You can go into extension, just not hyperextension. That's when you can get spinal fractures and vertebral fractures when they bump into against each other, which is fine if you don't have osteoporosis, but not fine if your bones are brittle. Now, if you do want to know what's the best exercise out there to improve your risk of, to decrease your risk of fractures and to improve your T-scores, I filmed an entire 12-minute videos on weight training for bone strength. It goes into which exercises to do, how many sets and repetitions, and a lot more detail. If you're interested, click on the link on your screen right now or in the description below.